Thank you, and hello everyone. I'm Abriti Arjal from Her International in Nepal, and today I will be talking more about the participatory action research approach that we took to address the gender norms and power dynamics of female community health volunteers in Nepal. So just to give you a brief on who the female community health volunteers are, so they are primarily the close to community providers, as my previous presenter also presented, and they are more engaged in community-based preventive and promotive activities, particularly bridging the gap between community and government health services and trying to reach the unreached. So there are almost more than 52,000 female community health volunteers at local level in Nepal, and they have been contributing to various health indicators and to prevent and in prevention of various diseases. So they have been, however, they have been facing multiple challenges, and effects of gender norms on their work and experiences is also one of them, which is very context specific and embedded and dynamic. So it is very important that we try and understand them and address them for them to effectively contribute to the work that they have been doing. So in order to do this, we did a small study in Chandragiri municipality of Nepal, where we actually tried to explore how participatory action research as an approach can support female community health volunteers in identifying and addressing the issues that is related to gender norms and power dynamics within both the communities and the healthcare system. So we took a PAR approach, where we started with the planning phase, where we tried to identify the issues and identify the root causes, and also discuss the solution or the action that would help address the issues. And then we moved on, as discussed with the participants, we moved on with the action where it was to develop a film that would show their lived experiences to the community and also to the stakeholders, which were further evaluated using observations, reflective workshops, interviews, and group discussion. But community engagement was a core of all this process, where female community health volunteers were continuously engaged in the process and were embedded within it. To talk more about the planning phase, where we tried to use a problem tree analysis methodology, where we identified the top problem, which came to be lack of recognition for FCHVs' contribution in both the families and communities. So this was an issue identified, and we tried to identify the root causes of this particular issue, more related to the gender and social norms. So based on these, we identified some of the root causes, and in order to resolve these root causes, we discussed the action, as I told previously, and then we came up with a conclusion that we would, or the community participant would want to develop a co-create a film reflecting their lived experiences, which is influenced by gender norms and values. So after agreeing to co-create a film, it started with the intervention development process. We had a series of workshops and series of discussion with female community health volunteers, where they wrote their scripts. They were trained in using GoPros, cameras, capturing video clips, and they also and we also did role play and exercises on different scenes, and prepared for the community filming, where they were given different tasks. Some of them were camera persons, some of them were audio recorders, some of them were actors, and they moved on with the community filming. They went to the communities with the GoPros, with the tripods, with the stands, with the audio recordings, and started taking the footages and the videos. And it was not a one-go process. It was a continuous engagement, where they took the scenes and then had a look at it, and then if they were not happy, they retook it. So it was a continuous and iterative process, where they were engaged continuously. So after this entire process, we had a final film produced in consultation and in co-creation with female community health volunteers, which was then showcased to a wider audience. And the showcasing event was led by the female community health volunteers themselves. So it was seen by more than 500 people in different events, and from diverse backgrounds. For example, teachers, stakeholders, ward representatives, local organization. And we also have this video on social media, YouTube, which has more than 1.2k views at the moment, which is, I think, a great achievement to kind of widely disseminate the lived experiences and the issues that female community health volunteers have been facing, which probably is hidden. And FCHVs did feel that it is a context-driven approach for identifying issues and co-creating solutions, which actually helped them to implement, which helped in the implementation process and was more effective to deliver the information with greater acceptability. So if you see the verbatim, we never participated in such workshop. It was context-driven and solution-oriented. The strategies were easier, and as we identified problems one after the another. And they did receive a good support from family members, community people, their peers, local government, and the study team, which actually enabled and helped them develop this video. So it also created a sense of friendship and shared learning between the researchers and the participants, and also community people and the stakeholders. However, they did had a mixed feeling of pride, fear, and accomplishment during the entire process of engagement during the co-creation process. And yes, male participation was a challenge because of the existing norms and values that we have in our society. So if we try to look at the change at the individual level, which is at the FCHV level, they did mention that there is an increase in self-confidence and communication skills and technical advancement in using cameras and sound systems, and also their personal identities that they have been carrying with them since many years that they have been working as an FCHV. And if you see, and then there's a verbatim, I realize that if people are taught, they are capable of doing anything. Likewise, FCHVs can do anything, including video making. So they did feel like it's a pride moment for them to have been made a film in a different role than what they have been performing for many years. And it also helped them develop a coping mechanisms towards the negative comments or the comments from the community and also from other stakeholders. Not only at individual level, but then it also helped to make some improvement or changes at the community, at the family and the community level. So it did improve the understanding and enhance support from the families for the work and the dual responsibilities that they were performing as an FCHV and also a caretaker at the household level. So many family members did share that the support has increased from the family, and then it's now much easier for them to go to work as an FCHV rather than which it was previously. And they also said that it would have, if this film was there before, then it would have been much easier for her to work in the past, as she has been facing a lot of negative comments from her family members. So similarly, it's the same. There was also change in perception and increased understanding at the community level, where they did mention of realizing the work that FCHVs has been doing, although they do see them almost every day, but then maybe not in a package kind of thing, like what FCHVs really do, and do they get the incentive or not, and on what basis or why they are doing this. So I think, and they mentioned that it was the first time they saw the video and realized okay, it's not, the FCHVs are working very hard for their community, and they are very important cadre in the health system for promoting health services. Talking about the videos as an approach, it was perceived to be one of the innovative and effective approach for communicating information. As people forget things, they listen, but when they watch, they never forget. So it is a good way to convey messages. I think the video has depicted the truth. So we can see from this statement how powerful the video making or the audiovisual aid can be in terms of translating the information and also changing the behaviors at different level. So there are also other verbatims, but then I wouldn't go through them all. However, we did make a good effort, and there were some changes, but still, it is very difficult to. It requires further efforts to actually create a just health system in the existing gender norms, and the challenges continue to persist in the community, and it does require additional efforts to address them. So in conclusion, PAR has been, participatory action research approach has seen to be a very supportive approach in a co-creating process, particularly in terms of co-creating a video, which has acted as a very innovative and powerful tool with a greater acceptability and greater impact. And it has actually helped amplify the voices of female community health volunteers within, and not only within the community but also beyond, and also addressing the social and gender inequities that they have been facing, which were not seen and not realized by many of the people in their community, by the stakeholders, and by different other cadres. And it's also yes, but then a long-term evaluation is necessary to assess the impact on the community, and further interventions are needed to address gender norms and power dynamic to motivate female community health volunteers. So I think that's all from my side. If you want to know more about this study, and if you want to have a look at the video, please visit Rebuild for Resilience website and Herd International website, and we do have a QR code here. So it's a really interesting movie. You can just type Female Cmty Health Volunteers in Nepal, and then it's available in the YouTube. So do have a look. Thank you so much.